The following program contains mature subject matter. Viewer discretion is advised.
We are back, and joining us now is board-certified orthopedic spine surgeon, our friend and colleague, Dr. Hooman Melamed. And before you find out how Dr. Travis did, Dr. Melamed, you're going to take us through the operation right here and show us exactly what you did for Travis.
We're looking at the spine model. This is the head here, the pelvis here, and there's 7 vertebrae in the neck. Number 1, 2, 3, 4, 5, 6, 7. The problem was on the right side between the 6th and 7th vertebrae, where the 7th nerve root was getting trapped in here. And you can see how the nerve comes from the spinal cord, starts going out, and there was a little piece of a bone spur that was growing, and it was digging into the nerve. And that's the area that needed to be cleaned up. And you had the disc from the bottom pushing a little bit, and the nerve was getting sandwiched. So we basically want to clean up the spur, allow more room for the nerve to go through.
You're in there with your loops, doing this under a microscope. And so I haven't seen any of this, but what I'm amazed by is how small the incision was to get in there and then open it up and do what you did.
So here's the surgery. We started the incision. The whole thing is done under the microscope. So we are carefully separating the soft tissue. We're getting down, basically finding to the bone, to the area I was talking about. And now we're identifying the area, and we put the little retractor there, which is very small. It's less than ½ an inch. And now we're going to take X-ray. You can see the size of the incision. It's about a 3/4 of an inch.
So Band-Aid surgery.
So yes, under the microscope. And now we identify, you have to know you're at the right level. So we have the instruments in, we're at the right level. We took the X-rays.
Oh, you make it sound so simple, and I got to tell you.
Now here, we're drilling. Look, we're drilling basically. You can see the drill is a tip of a pen. It's very small. So we're drilling, getting down to the spur right there, and we identify. And now I'm biting, where I was showing the little biting.
Right next to my spinal cord. This is when you're really happy that your doctor knows what he or she is doing.
Exactly. So now we're removing the pieces of the bone there. You can see I'm removing the little remaining of the fleck of the bone, and now we're going underneath, identifying where the disc is. So we're identifying the plane. The spinal cord is right there, and the nerve root is right there. We are working in about a 2 millimeter area. So I'm sweeping under the nerve, looking at the disc right now, making sure nothing is pressing.
And so you're basically freeing up that nerve. This is such, I have to say, even though that's my neck and my spinal cord, it's fascinating to watch. And the one thing
So we're just putting in, stopping the bleeding, and we're done, basically.
Do you have some of that left? Can I put it on a necklace or something?
Yeah. No. So these are the instruments, how small it is, basically. Look, this is what we're doing.
We use the term bone spur, so it's for the viewers out there, it just really means an overgrowth of bone. Is that related to wear and tear, or?
Yes, it's an overgrowth of the bone. Why does that happen? Like he was talking about it. I mean, nobody knows why. Why didn't it happen at the level above? Why did it happen there?
I think really going back in time, it was my 5 years before I came on the doctors as a Chippendales dancer. They had me doing all these.
All right, the truth comes out.
Yeah, right. How are you feeling?
Look, I am just a few weeks out from this, and obviously post-op, you dissecting those neck muscles, a lot of spasms, but I got to tell you, it's amazing. I can actually lay down with my head on a pillow at night and not be in the pre-op pain. And it is a remarkable feeling. I'm so full of hope again. Obviously, I can't get back to doing the things I want to do yet. You've told me I got to, recover and then get back to biking and hopefully all the things I love to do. 3 weeks away. 3 more weeks.
3 more weeks, you're done.
Because for me, the hardest part of this has been I can't do the things I love to do. So beyond the numbness, the pain, you not being able to do the things you love to do in life, there comes a point where enough's enough. So thank you, sir.
Thank you.
The show had to go on, and I know that you sucked it up. Congrats to both of you. Great work.
Thank you.